Welcome to A Balanced Life on the Go. I'm Dr. Nicole Lindsey, your host on this podcast, along with Dr. Bryan Gennett. This is a podcast designed to help connect you to a more balanced life on the go. Each week, we will bring you simple, concise, and easy to implement ideas, tips, and strategies to help you connect to better nutrition, movement, and thinking so you can achieve balance in your busy life. Isn't this what life is all about? Trying to achieve balance so that we can be healthy, happy, and live to our fullest potential. We're glad you joined us. Let's get started. Welcome. This is Dr. Nicole Lindsey.
And I'm Dr. Bryan Gennett.
And this is podcast number 2. So, 50 million Americans are doing it. Are you?
I'm doing it.
I know you're doing it. I'm doing it too.
Yeah.
Question is, are you who are listening doing it? What is it?
50 million Americans annually visit their chiropractor.
Yes, they do. Yes, they do. But what is chiropractic?
Chiropractic's been around for over 100 years. It started in 1897 by D.D. Palmer.
Correction, 1895. Yes, and we're going to talk about what chiropractic is, the benefits, why you should see a chiropractor or why you might want to get checked by one. We're going to talk about some of the different techniques that are used, and then we're going to give you the one thing that you should do today in regards to this to help safeguard your balanced life on the go, because that's what we're all about. Before we jump into that, we need to talk about something important. What color socks are you wearing today, Dr. Bryan?
I wore a very special pair of socks today. It is almost Christmas, so I wore my patented Christmas socks. I got a nice little red
They're
bow
sparkly
on.
too.
Very sparkly. They are definitely not children's socks that I'm wearing. They are socks meant for grown men.
Very nice.
So
very nice. We're gonna have to get a picture of these.
Have to put that out there.
They're very nice. I like your choice today.
They're a little sparkly. They got a little sprinkle of sparkle. Little flash.
In order to be a chiropractor, you have to be a little crazy and like to have fun.
Yeah.
That goes along with it. So chiropractic. So the word chiropractic, did you know that it means to be done by hand?
I did.
It's very cool. So when we happen to use our hands a whole lot in this practice, there's a lot of different techniques that chiropractors use. We'll talk about that in a few minutes, but that's what that word means, the practice of doing something by hand. The definition
is a healthcare profession that focuses on the spine and other joints of the body. And it's this spine and joints of the body that has connection with the central nervous system.
So what's interesting is a lot of people think that chiropractic is just about treating back pain and neck pain, which
so much more than that.
Yeah, I mean that's right. We do work on that. That's what brings a lot of people to us, and we're good at that. We can oftentimes get rid of those aches and pains very fast and get people back to balance, right?
Back to balance.
But more importantly, as a chiropractor, just like you said, we work on your nervous system. And we want to make sure that nervous system, which is your brain and your spinal cord,
mm-hmm.
is functioning at 100%.
Mm-hmm.
So what is the brain's role in the human body?
The brain does everything. The brain is your central computer. The brain tells you to breathe.
It's your hard drive.
The brain tells your heart to beat. The brain, you would not be alive without the brain.
Yeah, and it's the only organ in the human body that's completely encased in bone. Your skull wraps around it to protect it. So
your spinal cord is encased in your spinal column. Those bones that are around it.
24 movable.
Absolutely.
Protecting it all the time. So that is your central nervous system, your brain and your spinal cord. And this is something that's really important. It happens all the time, every single time when two cells come together. The very first organ to develop in the growing embryo is what?
It's your CNS. It's your central nervous system.
The brain and the spinal cord.
Yeah.
A lot of people say heart.
Mm-hmm.
You know, they think the heart is the central organ of the human body, but it's actually the brain. And that is because it's your hard drive. It controls everything else.
It's that neural tissue that is formed.
Yeah, and you know, one of the most important things about chiropractic is that we help people, first of all, achieve health naturally.
Mm-hmm.
So a lot of people come to us that didn't even realize that they're unhealthy or that their life is out of balance. And we help them get there, and then we help them maintain that level of health and balance while helping them to avoid unnecessary drugs and surgery.
A lot of people know that chiropractors, you know, what they would say, like, oh, just pop my back, pop my neck, do all that. And we do specialize in spinal health. But another thing that we specialize in is actually well-being or optimal health. Now, Dr. Nicole, are you healthy if you're on a whole bunch of medications?
No, actually, that's something that we were just talking about the other day. You know, we ask patients that all the time, do you have any health problems? And they'll say no, but at the same time, they'll hand us a list of 10, 15 medications. And it's kind of like an oxymoron, you know? Can you be truly healthy if you're taking and living on 15, you know, medications every day? I mean, I don't know. That's a question that, you know, we all need to ask ourselves.
I mean, in absolutely every case and every person, every individual is different. Mm-hmm. But the short answer is that you aren't living your optimal wellness if you are on so many medications.
Yeah, you really have to think about how that's affecting your nervous system, you know, all those chemicals all at once. And then if you take over-the-counter medication on top of it, you know, what is that doing? I don't think anybody really knows. But the bottom line is, in order to be truly healthy, to be as balanced as you can be, you want to try and live your life healthfully. And chiropractic is a big part of that. I know when the very first time I heard about chiropractic, my sister happened to be dating one as her boyfriend, and I was struggling. I was en route to become a pharmacist. This is what I thought I wanted to do for a living. And I was frustrated because right about that time, before I was about to pursue this career, I had a really good friend who had never heard about chiropractic, never been to one. He was playing basketball with his friends. He was 20 years old, just shy of his 21st birthday. And all of a sudden he had trouble breathing. And he went to his family practitioner, because that's what we do,
primary
right?
care, yeah.
When something's wrong, most of us go there first. And the doctor examined him and said, oh, you've got asthma, use this inhaler. And he used it. And unfortunately, a few hours later, he had an allergic reaction to the medication. And he ended up passing away. And this happens, unfortunately,
more often than not.
Yeah. And that happened right about this time when I was about to pursue this career. And I was struggling because I knew that I would be behind the counter handing out asthma inhalers to people and giving them to your friends and family and the future kids of this world. And I had a problem with that, knowing what it did to my friend. And I'm one of these people that, you know, things happen for a reason. And I thought, you know, I don't think I struggled with that. I don't want to do this for a living. There's got to be a way to help people heal naturally. And right as I'm questioning this career path for myself, I asked this chiropractor that my sister was dating, what do chiropractors do? Don't you crack backs? Don't you just fix back pain? And fortunately, he was a very philosophical, very passionate chiropractor, a very good one. And he educated me, and he said, no, that's not all we do. We do definitely help back pain, but what we do is restore the nervous system so that the body, the human body, can function at 100%. So we help people avoid unnecessary medications and surgeries. And it was like the light bulb went off. I needed to hear that right then and there, because that's exactly what I wanted to do. And I said to him, how do I do this? And he said, go to chiropractic school. And that's what I did.
That's a good story. I like that.
How about you? What's your story?
My story's a little bit different than that. I ran track and field in college, and I pole vaulted. And my coach at the time, her coach was when she was in college, her coach was a chiropractor, and he ended up opening a practice near our college. And I didn't really understand it, but my coach was my coach. I listened to my coach, and she told me that I had to go to a chiropractor. She said I had to go see a chiropractor if I had any problems at all with my back and my neck. I just had to stay healthy during my athletic season. Well, seeing this guy, he was helping me with my back pain. He was helping me with, this and that. Later on in the season, I ended up hurting my ankle. And I saw 3 athletic trainers. I saw 2 of our team doctors, a general practitioner, and then a surgeon. And then I saw 4 physical therapists at our school. And each one of those providers gave me a different diagnosis with what was wrong with my ankle. And not any of those providers could have told me what was wrong at all, right? So I'm in this boot, I'm wearing this boot, and I had this boot on my ankle for like 6 months. And I keep going to my chiropractor's office. And after 6 months, he was finally like, dude, what are you doing? Why haven't you told me about what's going on with your ankle? You've been coming in here day after day, not telling me anything about your ankle.
But don't you just fix backs?
That's what I said. I was like, I didn't know any better. I was like, you just do back pain, you just do neck pain. He's like, no, I do so much more than that. He's like, come over here, man. Take your boot off. Let me look at it. And he did. And he was like, all right, I'm going to adjust it. I'm like, you can do that? He's like, yeah, absolutely. There's a joint in your ankle. Chiropractors adjust joints. I can adjust this. And he adjusted my ankle. Nothing up into my point in that life had ever hurt more than when he adjusted my ankle. But I walked out of there without a boot on my foot.
Nice.
A week later, I was back in practice. I told the doctors, I told the physical therapists, I told my athletic trainers, and all of them kind of just brushed me off. They're like, well, that's not true, but whatever. We don't really know. So after that, I was just really enthralled. I was just asking him a whole bunch of questions. A year later, he ended up selling his practice. And on my last visit to him, he walked me out. He walked me up to the front, said bye, did that whole thing. And he handed me a letter of recommendation for chiropractic schooling. He told me, you're going to chiropractic school, and you're going to Palmer College of Chiropractic because that's the only one that you're going to. And at that time, I didn't really know what I wanted to do, and I said yes.
Awesome.
I'm going to chiropractic school.
That's awesome. So good to have leaders and mentors in your life that can help you find that path, because sometimes you don't always make those connections, and we flounder. I remember that in college, just feeling lost, and so
not knowing what you wanted to do.
Yeah, that's a great story.
Those answers come from unlikely places.
And there are signs everywhere, the fact that you were able to walk out of the office after that, and you're an incredible athlete, so not being able to have your ankle
it was insane.
function was terrible for you.
It was insane, especially because I'm a pole vaulter. I jumped and I had to jump off that ankle. It blew my mind. It absolutely blew my mind. I was amazed.
So some of the benefits of chiropractic, God, there's so many, but some of those, of course, the typical low back, neck pain, headaches. We see a lot of that. People that suffer with migraines that have for years and years and years oftentimes don't know that could be coming from their neck.
Mm-hmm. And then that causes so many other things. Poor sleep, and then poor irritability when you wake up. Then poor performance at your job. There's this trickle-down effect that happens. It's a domino effect from that one domino that fell.
Yeah. So definitely extremity issues, that's another thing that chiropractic can help with, just like with you. You wouldn't be here if it weren't for that, right?
No,
so
I don't know where I would be.
Pain. Yeah, it's crazy to think about that, right? Shoulder pain, we see a lot of that.
Knee pain, hip pain.
Digestion issues. That's another thing. The nerves that come off of your spine, they go to your bowels. And this is something that I often think of. When we were in chiropractic school, we had to dissect human bodies.
Yeah.
Just like med school. Our curriculum is very similar. But we branch off and learn adjusting techniques in nutrition, and med students will learn pharmaceuticals and do rounds in a hospital. But up to that point, it's identical. We're doing
we have the same 3 years of education.
Same 3. So we dissect the brain, we dissect the human bodies, and when we were dissecting one of our bodies, we pulled out the intestines, And it was fascinating to see the nerves, the nerves attaching to every single section of the bowels. And you have how many feet of bowels?
20, 30.
In your body, and every single square inch of the intestines had a nerve that connected to it.
Mm-hmm.
So if the nerves coming out of your lower back there's pressure from tight muscles. Say you sit for a living at a desk all day, and now you have tight muscles in your lumbar spine. Could those muscles possibly affect the nerves that are going to a section of your bowel and interfere with your digestion and cause you to be constipated?
It's a good question. And, most of us don't really make that connection or draw that conclusion. But one of the things that we often see, especially in pediatric patients, sometimes especially in babies, like even really small infant children, that when they're having bowel or bladder issues, that an adjustment can actually make them use the restroom.
Yes, absolutely. Right there. Right then and there.
On the table.
On the table.
Yeah.
So it's happened.
Thank God for diapers.
Yes, yes. So the benefits are many. I mean, fatigue, being tired, anxiety. What's interesting is when chiropractic first started, the very first chiropractic adjustment, this is a very, very interesting story, and a lot of people don't realize this. 1895, we have D.D. Palmer. He was the founder of chiropractic. He was into magnetic healing.
Magnetic healer, yeah.
Knew a lot about the human body and the anatomy, and he was working in this building, and there was a janitor. His name was Harvey Lillard, and he was working in the room that D.D. Palmer was in, and they were talking, and Harvey said, I fell off a ladder 17 years ago, and when I did, I landed on my neck and shoulder, heard a pop, and ever since then I've been deaf in my one ear. And D.D. Palmer said, that's kind of strange. That's odd. Come here. And he felt his neck, and he knew a lot about the human anatomy. And he could feel that a bone was out of place in Harvey's neck. So he put that bone back in place. He gave Harvey an adjustment. He didn't know what he was doing, but he knew that he needed to get that bone back in place. When he did, Harvey got his hearing back.
Mm-hmm.
That's how it all began. That was the very first chiropractic adjustment. And that's how it started. It wasn't because of back pain getting better. It was because the nervous system was being impinged upon and the body wasn't working at 100%. So that was restored when the pressure was taking off the nervous system. So that's what chiropractic is. That's what it's really about. And the benefits vary depending on what you have going on inside of your body and where your nervous system has tension and pressure. It's different for everybody. So do we cure cancer?
No.
Do we cure depression?
No.
Do we cure back pain?
Yeah. Trick question. We do. We can help it.
Yes. We really don't like to say we cure anything, but we help restore your nervous system, and wherever your pressure is, your lack of, where your dis-ease is in your body, when we restore that, your body gets back into balance and can heal from virtually anything. And
really speaking, that is our number one goal. Number one goal is actually prevention. Our number one goal is education. Our number one goal is diagnosis and care, and to treat our patients to help restore this balance, to help restore the body's ability to heal itself. I mean, our body's amazing. It's truly
it really
wonderfully amazing. You cut your finger, it heals. You break a bone, it heals. You cut your hair, it grows back.
You don't have to tell it to do that.
It does it automatically. Your body's a regenerating organism. It heals. And so as we age or other things happen, lifestyle factors, poor diet, nutrition, lots of trauma from car accidents, falls, spills, childhood, you fell off a ladder, you broke your arm, you did all this stuff, that can inhibit your body's ability to heal itself. And our goal is to increase the body's capacity to heal.
Excellent. Yeah, that was very eloquently put. Going back to what you said about the body being very intelligent, this is something that our profession
knew 100 years ago.
Exactly. And that is what one of our major premises is for our profession, is to respect that innate intelligence. You have it, you're born with it. Your body always knows what it's doing. I need to repeat that. Your body always knows what it's doing. Oftentimes we are so disconnected from that internal voice, from that internal wisdom, from that innate intelligence that we can't hear it. We can't hear what it's saying. So we as chiropractors want to connect you back to that so that you can experience health.
Mm-hmm. The best example that I could give you, we're not going to go into it, but it's something I want you to think about, is high blood pressure. Why do we get high blood pressure, and why do we think we have to treat it? Or why do we have high cholesterol, and why do we think we have to treat it? Now, those are kind of very lengthy answers. So what I want to do is I want to challenge you, when you come in here after hearing this, ask us about that. Or ask your primary care doctor about that, and have them explain to you, or have us explain it to you, how that body works and how it's affected that.
Yes, exactly. Or post it. You can email us as well.
Absolutely, yeah.
So how do you know that you need a chiropractor?
Do you have a spine?
Right.
Okay.
Yes, exactly.
Have you been in any sort of injury? Car accident, whiplash? Do you play football? And you're a quarterback, you get tackled like crazy.
And it could be an old injury.
Could be an old injury.
Never taken care of, right? Something chronic.
Mm-hmm.
It could be your lack of energy, your insomnia, your anxiety, your just living this life of disconnection and dis-ease. Having poor posture, that's another thing
that's
too.
Yeah.
And that's something that you can actually do yourself and check your own posture and see if you might need a chiropractic appointment to get an evaluation. Very simple to do. You can just look in the mirror at yourself, and you want to eye up your shoulders. Are your shoulders level? Are your earlobes level? If you have a belt on, or lift up your shirt, look at your pant line, your hips. Are they level as well? If they're not, that could indicate that there's some kind of imbalance in the body where the bones are shifted, your rib cage might be rotated, you've got a head tilt, tight muscles on one side.
Some sort of compensation going on. Yeah,
exactly.
So that's what it would look like face on. The other thing that you need to do is turn to the side. Have your spouse or set up the timer on your cell phone, or friend or family member, whatever. Take a picture. Mm-hmm. And is your ear over your shoulder? Is your shoulder over your hips? Are your hips over your knees? Are your knees over your ankles?
Should be a straight line.
Perfectly straight line. Think of a plumb line all the way down. And you might see that you kind of look like this zigzaggy little, runner from the crocodile thing.
Yes. And, this day and age with computers and texting, we're seeing a lot more of this forward head posture. And that is a clear indication that you need a chiropractic evaluation, especially with children, because if they're in this position now at a young age, what's it going to be like if it's not corrected later on? And that usually leads to neck pain, headaches, shoulder injuries, and on and on. So
you're going to be like your grandma who claims she shrunk 6 inches because of old age.
That's right. She's just hunched forward because of that forward head posture. So those are ways that you can check your own posture to see if chiropractic is something that you might need. So as always, we always want to give you one thing that you can start doing today to implement into your busy life so you can achieve this balanced life on the go. So, Dr. Bryan, what is the one thing that we want to give?
So the one thing that we already talked about is checking your posture. The other thing that we talked about is that one of our main goals as chiropractors is that we want to increase your well-being. And what we want to do is, if you want to increase your well-being, if you want help with your well-being, or if you want to take your well-being to the next level, go see your chiropractor. Make an appointment, come see us.
Only if you want to improve your
Only
well-being.
if you want to improve your well-being.
You know what's really cool is that chiropractic is the second largest healthcare, right?
In the country, yeah.
Yeah, in the country, behind Western medicine. And we specialize in this, in improving your well-being. We specialize in that.
That's our main focus.
So if you want a piece of that, if you want to push yourself to feel better, to heal better, to have more balance, if you want to be better tomorrow than you are today, go see a chiropractor.
Absolutely.
All right, folks, thanks for listening. Tune in next week for our next podcast.
Appreciate it.